Hi, this is the second mini lecture about anxiety disorder treatment. This is going to be a really short one where I'm just going to introduce the concept of behavioral experiments for social anxiety disorder as both an exposure that gives people the opportunity to experience habituation and safety learning to feared social situations, but that also produces more explicit cognitive change. It gives people a chance to prove the predictions of social anxiety wrong. Okay, so we're going to start with a video of a psychotherapy demonstration. So this is a pretend patient and therapist together working on a plan for a behavioral experiment for social anxiety.
What I'm thinking now is, how do you feel about if we did an experiment to test out your thoughts on what would happen if you stopped doing these things? If we did a bit of a role play where we pretended to enact a situation at work.
Okay.
And if we did this maybe twice, and the first time you do all the things that you normally do,
Okay.
you grip onto something, look down. Is there anything else that you do when you're in these situations, these work conversations, to try and cope?
I just kind of will just like fumble and like kind of just clench whatever it is I'm holding just really tight and just make sure I don't make any eye contact.
Okay.
At all, just kind of get through it.
Okay, so in the first time, I want you to do those things as much as
Okay.
you normally would. In fact,
Okay.
maybe even slightly more than you normally would.
Okay.
And then the second time, I want you to drop doing those things altogether.
Okay.
How does that sound?
Okay, I'll try my best.
And how would you feel about if we filmed this so you could actually see what you looked like?
Okay.
Do you have a camera with you that we could video on?
Yeah, is my phone okay?
Yeah,
Yeah?
we'll use that in just a sec.
Okay.
Okay, before we do this then, we're just going to fill out this form. It's because what we're doing now is an experiment. We call it a behavioural experiment to see what happens when you change the way that you're behaving.
Right, okay.
Okay, so the first column says that I need to fill out an experiment to test this thought that you have.
Yeah.
So our experiment is going to be that we do a conversation at work. Who should I play? If you're playing yourself in this role play, who should I be?
Maybe like a client at work. I always have to sit down with clients before we do the shoot and kind of
Okay.
get to know a little bit more about what they want.
Okay, so would it work if I was maybe having a wedding and I was hiring you to be a
Yeah.
wedding photographer?
Yeah.
Okay. What kind of problems do you see coming up in this conversation that we have? Like, what will you see yourself doing on camera?
Shaking, like being really obviously shaking and
Okay.
bright red and
Okay, so visibly shaking. So how much will you be shaking? If 100 is like shaking uncontrollably and 0 is not shaking at all, how visibly shaking will you be?
90.
Okay.
Okay, so I'm going to stop it there, but you can continue watching the video to actually see what a behavioral experiment looks like and how it's processed. So in that little clip of therapy, what the therapist is doing is asking the patient to describe what the actual feared outcome is that she's trying to avoid with some of the safety behaviors that she engages in social situations. So you might remember her from the social anxiety disorder lecture where she talked about looking down, not making eye contact, not talking very much because she thought her voice would shake, clenching her fists or holding onto something really tightly so that people couldn't see her hands shaking. So the therapist asked her to describe all of those feared outcomes, all of the things that her social anxiety is telling her will happen in a social situation if she doesn't engage in safety behaviors. And the therapist actually asked her to put a number on it. So on a scale of 0 to 100, with 100 being shaking uncontrollably, how much will you be shaking? In this case, they actually film the behavioral experiment. So they give her a chance to see what her behavior looks like, both with and without the safety behaviors. And the goal is to give the patient a chance to either prove or disprove the predictions that their social anxiety leads them to make. Their expectations about how they'll perform, because remember, people with social anxiety disorder really underestimate their own social skills, or their expectations about how other people will react to them. And on a neural level, what they're experiencing in this situation is safety learning. They're experiencing it both neurally and cognitively, consciously. They're learning that the feared outcome is less likely than they thought it was, that they don't need to engage in safety behaviors to prevent it from happening, or that the anxiety they feel in social situations is less obvious to other people than they think it is. So, for example, one of her feared outcomes is that if she doesn't hold on to something really tightly, her hands will shake uncontrollably and it will be really noticeable and really obvious to everyone. in the behavioral experiment that they do, they actually film her engaging in a social interaction without clenching her fists, without doing the things that she usually does to hide her shaking. And she can watch that tape and actually see, was my shaking as bad as I predicted? Was it really a 90 out of 100 in terms of severity? In other types of behavioral experiments, we might have patients actually go into a social situation and do something that they normally wouldn't do, whether it's make more eye contact than they normally would, ask a question in class, walk into a party alone, go to a social situation without having their phone with them to act as kind of a safety blanket, and making predictions about, for example, how many people will react to them negatively, how many people will stare at them, how long people will look at them for. We might even, in a therapy office, we might even have people actually go around and have multiple interactions with other people in the office, and then have those people rate on the patient's own scale how much they were shaking, how red they were, how anxious they seemed, how awkward they were. Behavioral experiments are about collecting data and giving the patient a chance to make a hypothesis. My anxiety is telling me that this social situation will be the worst thing ever. I'll humiliate myself. My anxiety will be visible to everyone, and then actually test those predictions. So as an example, say that you have a patient who is really nervous about public speaking. And the reason he's even coming to therapy in the first place is because his brother asked him to be the best man at his wedding. And he knows he has to make a speech, and he's terrified to do this. His anxiety about that situation is almost 100 out of 100. So like all exposure, we would start with a hierarchy. You wouldn't necessarily have him do the scariest possible thing without doing other scary but less scary things to prepare. So we had this patient build a hierarchy, and he created a list of 10 situations that would cause him varying degrees of anxiety. In planning a behavioral experiment, we would have him choose one of these situations. For example, eating lunch with classmates that causes a lot of anxiety, but not necessarily the highest level of anxiety. And we would have them make predictions about what is the worst thing that could happen in this situation. What is it that you're expecting will happen that motivates you to avoid this situation of eating lunch with classmates? And the patient might say, I think that my voice will shake. I think that I might say something awkward. I think that people will be able to tell how anxious I am and that they'll feel sorry for me. So the next step is asking, okay, how will you know? How bad will your voice shake on a scale of 1, where it's not shaking at all, to 10, where it's shaking so much that people can't even understand what you're saying? So if you say something awkward, how will you know that you said something awkward? How many awkward silences and pauses in the conversation will there be right after you said something? How will you know that people feel sorry for you? How can you actually measure and test that prediction? Basically, exposure gives people a chance to ask, what is the worst that can happen? And how likely is that worst case scenario to come true? Then in the debriefing part, after the patient goes out and does this exposure for homework and then comes back to the next therapy session to tell you about it, or in the case of the behavioral experiment in the video, after you actually practice it in the session, you engage in debriefing. So you ask the patient to give you their results. Did your voice shake? Yes, but it wasn't that noticeable. It was definitely not as bad as I predicted it would be. I thought it would be a 9 out of 10 and that people would almost not be able to understand what I was saying. But really, it was more like a 5 out of 10. I was definitely anxious. My voice was definitely shaking, but it didn't seem like anyone noticed or prevented people from understanding. Were there any awkward silences? I noticed a few, but I also noticed, because I was paying more attention to them, that they didn't all come after I said something. I actually noticed other people said things that were kind of awkward too. So as much as possible, we ask people to put a number on things. You thought that your anxiety while eating lunch with friends, classmates, would be a 55 out of 100. What was the highest point your anxiety reached during that lunch? What was the lowest point it reached? And what do you think it would be the next time you did it? It's okay if their anxiety got to 55 out of 100 or even higher. We don't necessarily have to prove every prediction wrong, but what we are proving from the situation is that you can go into a situation, you can have anxiety that high, and it's not the end of the world. Nothing bad will happen. People won't notice. So debriefing essentially helps the patient recognize that the situation was not as bad as their anxiety led them to believe that it would be. Their predictions either didn't come true or they did come true, but the consequences just weren't as bad as they thought. So this is another example of someone engaging in behavioral experiments. This link in the slides goes to Jia Zhang's rejection therapy blog, where he basically treated his own social anxiety by not just putting himself in benign, normal social situations, but actually seeking out opportunities to have people reject him and say no to him, which were sort of his biggest feared social situations. So he treated his own social anxiety disorder by engaging in one awkward, unpleasant social situation every day, one social situation that would involve rejection every day for 100 days. And this is the first one that he did.
All right, this is my first try. I'm gonna try to borrow $100 from a stranger. This is very tough, but let's give it a shot. Excuse me, do you think I can borrow $100 from you?
No?
No?
Why?
All right. No, okay, sorry, thanks. All right, that wasn't too bad. I didn't know he was a security or someone. I don't know, he just sits there. He looks like a security guard. I thought he might pull off a gun or just yell at me or something, but he just said, no, okay, that's not too bad. So, first day was a success.
All right, so you can see what he did there. He went into this situation with really negative, catastrophic predictions. He thought that this person would get really angry. He thought that he might even pull out a gun. And by putting himself in that situation, he was able to prove those anxious predictions wrong. He still got rejected, but it just wasn't as bad as he thought it would be. So, based on what we talked about in this lecture, I'm actually going to ask you guys to test this out for yourselves and do a self-experiment with social anxiety. Because just like every other disorder, social anxiety exists on a spectrum. People who experience really high, debilitating levels of social anxiety have a disorder, but everyone knows what it feels like to be embarrassed or to feel socially awkward or to be motivated to avoid a difficult social interaction. And specifically, fear of embarrassment is really key to social anxiety disorder, but it's not unique to it at all. Nobody likes feeling embarrassed. Most of us do what we can to avoid feeling embarrassed. In fact, even people who aren't socially anxious tend to overestimate the extent to which their embarrassing behavior that they feel embarrassed by, is noticeable and obvious to other people. And this phenomenon is known as the spotlight effect. So the spotlight effect refers to the cognitive bias that everyone has to overestimate how much observers of our behavior notice, remember, or even care about the things that we do. So this figure comes from an experiment where undergraduates at a university were told to wear an embarrassing t-shirt around campus. In this case, the t-shirt had a picture of Barry Manilow on it. The undergraduates in the study were asked to predict how many people would notice their t-shirt. So they made this prediction. The average prediction was that about 45 people would notice the t-shirt. Researchers actually tested this prediction by having the undergrads go out and walk around campus while the researchers followed them around. And after the person had walked by, asked people nearby if they noticed their shirt. There was a control group here, two control groups actually, of people who weren't wearing the shirt who were asked to predict how many people would notice the shirt wearer's t-shirt. So what we're seeing here is that the number of people that the person wearing the shirt thought would notice them is dramatically higher, about twice as high as the number of people who actually noticed. And people who weren't in the situation themselves, who are a little bit more objective, were much more accurate at predicting how many people would notice than people who were in the embarrassing situation themselves. This is the spotlight effect. Our behavior, the things that we're doing, is really noticeable and salient to us. And we tend to forget that we're just not as interesting to other people as we are to ourselves. Other people don't notice us as much as we notice ourselves. So in the social anxiety self-exposure I'm going to ask you to do, I want you to pick a scenario that you predict would be embarrassing for you, but definitely not intensely humiliating, nothing that would like ruin your reputation or be super humiliating for you or anyone else. So an example would be something like this Barry Manilow shirt experiment. Wear a shirt with something dumb on it, wear your shirt inside out, introduce yourself to someone who you've already been introduced to, ask a question in class that you think the answer to is really obvious, wear nail polish if you don't usually wear nail polish, go out with your makeup not done or messed up if you're someone who wears makeup. And before you put yourself in this situation, ask yourself, what's the worst thing that could happen? And then make really specific predictions. How many people do you think will notice you? How many people do you think will stare? How many people do you think will say something to you? How many people do you think will point and laugh at you? So once you make those predictions, test them out. Put yourself in the situation, repeat the action, stay in the situation, and give yourself a chance to really test your predictions. And then afterwards, evaluate whether your predictions really came true or not. So see if you're susceptible to the spotlight effect. See if you overestimate how noticeable this mildly embarrassing action will be. And that is a behavioral experiment.